Hello students, this is a question about the portal vein. Okay, the question reads like this: write about portal vein under following heads. Introduction, where I will introduce you with the what is a portal vein, definition of portal vein. Then we will learn about the formation of the portal vein, then the course of portal vein, termination of the portal vein, then the various parts of the portal vein and their relations. And lastly, we will learn about tributaries and the applied importance of the portal vein. Let us come to the first part of the answer, that is introduction. The big question is, what is a portal vein? We should learn about what is a portal vein. Usually the portal vein is normally there is the presence of a single set of capillaries plexus between artery and vein. When the artery repeatedly divides, it becomes a arteriole, and ultimately the terminal arterioles in an organ breaks up into capillary plexus, which has an arterial end, another end is the venous end, where the venules they unite to form a vein. This is the usual course of the arteriovenous capillaries, where the capillaries are present everywhere in our body, in all the tissues of body except very few. So this is the usual, the formation of the capillary and the venules and then the vein. But sometime what happens that the vein which has formed after the capillary plexus, this vein, see this again breaks up into a second set of capillary, in some other organ or sometime within the same organ. For example, in kidney, it breaks up into two sets of capillary within the kidney organ itself. But in most of the cases, it breaks up into another organ also. This second set of capillary will then unite, the capillary plexus will unite to form a vein, form a vein again, Now the vein here between the two sets of capillary, see here, this is one set of capillary and this is another set of capillary, and this vein between two set of capillaries is called as the portal vein everywhere in body, between two sets of capillary, whatsoever vein is present, it is called as the portal vein. Now the best example of the portal vein is where the first set of capillaries are formed in the intestine, whether it is a large intestine or it is a small intestine, their wall will show the presence of the capillaries, and these capillaries will form the vein, and this vein will unite with each other to form the portal vein, and then this portal vein go into the liver, where it will once again break up into the set of capillary. Here they are called as sinusoids, and then again these capillaries will unite to form the hepatic vein, and hepatic vein will unite ultimately and open into the inferior vena cava. So this is the portal vein. This is, so you should know what a portal vein is there. Now in case of our portal vein, a portal vein is a large vein, about which we are talking into the abdominal cavity. It is a large vein which collects the blood from small and large intestine. Most of the small intestine blood is collected by superior mesenteric vein, and the large intestine blood is collected by the inferior mesenteric vein. The blood in the in the portal vein also come from the spleen, through the splenic vein, from the pancreas and from the gallbladder. So these are the structures or organs which pour their venous blood into the portal vein, into the portal vein. and then this portal vein goes into the liver to form, as I said, sinusoids or capillary. Sinusoids are a type of capillaries which are much more dilated, and this sinusoid drain the blood into the hepatic vein, that is to the inferior, through hepatic veins into the inferior vena cava. Now the portal vein here in the abdominal cavity, the portal vein, it transport the product of digestion. So what food which we eat, okay, it is in the process of digestion, and this partly digested food from the intestine is brought to the liver for the further digestion or metabolism. Okay, now this portal vein and its tributaries have no valves. Okay, that is a peculiarity of the portal vein. Neither the portal vein nor its tributaries, many tributaries are there which forms the portal vein, they are valveless, though they are draining the blood into the anti-gravity direction towards the heart. Okay, towards the heart, but they don't. I think this much of the introduction is enough for that of the portal vein. Okay, it is enough. Let us come to the, after this introduction, we come to the second point, how the portal veins are formed. Okay, now the portal vein, okay, in the abdominal cavity, it is formed by, okay, the union of superior mesenteric vein, which I said that superior mesenteric vein brings the blood from the small intestine and part of the large intestine too. So this superior mesenteric vein, okay, unite with that of the splenic vein to form the portal vein. So it is primarily the union of the splenic vein which brings the blood from the spleen and the blood brought from intestine through superior mesenteric vein, they unite, okay, to form the portal vein. And this union of the superior mesenteric and that of the splenic vein, it takes place, okay, behind the neck of the pancreas at the level of the second lumbar vertebrae. Okay, just behind the neck of the pancreas. Okay, and the label is where it is at the level of second lumbar vertebrae, the posterior abdominal wall. Okay, the portal vein is thus about 8 centimeter long. Let us see in this diagram the formation of the portal vein. This is the spleen. You see, this is the porta hepatis. This is the hilum of the spleen. Okay, this is the, and through this hilum of the spleen, multiple veins are coming out from the hilum of the spleen, and they form a single splenic vein. And this splenic vein is passing through the substance of the pancreas. It is passing through the substance or more towards the posterior wall of the pancreas, posterior aspect, okay, within the substance. So this is the splenic vein which is bringing the venous blood from the spleen. Okay, venous blood. Now this vein is, the splenic vein is joined by the inferior mesenteric vein, okay, which brings the most of the blood from the large intestine. So it is joined by the inferior. Now this tributary of the splenic vein, inferior mesenteric vein, and ultimately this splenic vein will go towards the neck of the pancreas, where in the concavity of the duodenum here, this will join to this larger vein called as the superior mesenteric vein. See this superior mesenteric vein bringing the blood from intestine, lying on to the anterior aspect of the third part of the duodenum, then it lies in front of the uncus of the pancreas, okay, and then it enter inside the substance of the head of the pancreas, okay, and at the neck here, okay, there the splenic vein joins it here. Okay, so this is the splenic vein is joining to the superior mesenteric vein, and from this point onward up to this point, this is the portal vein. So the portal vein has formed at the neck of the pancreas by the junction of or union of the splenic vein and that of the superior mesenteric vein. Okay, so this is the formation of the portal vein, okay, which is about 8 centimeter long, right up to porta hepatis of the liver. From this neck of the pancreas, it runs upwards and more towards the right side, and then this is the portal vein, which is about 8 centimeter long. Okay, let us see the course of, after the formation of the portal vein, we will see the course of the portal vein, where it is going, okay, where it is going. After its formation, the portal vein runs upward. It is running upward and slightly to the right side behind the neck of the pancreas, okay. It is running behind the neck of the pancreas. Then it will run behind the first part of the duodenum. So first it runs behind the neck of pancreas after its formation, then it goes upwards, and then it goes behind the first part of the duodenum here, okay, and then lastly it runs in the fold of the peritoneum, okay, that is the right free margin of lesser omentum. Then it will run in the right free margin of the lesser omentum, and anterior to which lies the hepatic artery and the portal, the bile duct, hepatic artery and the bile duct, which will lie anterior, and all three structures will be enclosed in the peritoneal fold, which is the right free margin of the lesser omentum. So the portal vein here in the supraduodenal part is just, okay, forming the anterior anterior boundary of the porta of the epiploic foramina, okay, or foramina of the lesser sac, or additus to the lesser sac. So this is that part of the portal vein, and as it will reach to the porta hepatis, okay, then at the right margin of the porta hepatis, it will divide into two branches, right branch and the left branch of the portal vein, okay. So this is the course right from its formation to its termination into the right branch and the left branch, okay. So let us see now, after course we will see the termination of this portal vein. The portal vein terminates at porta hepatis by dividing into right and the left terminal branch, or the left branch, right branch or the left branch. The right branch of the portal vein, see this, this is the right branch of the portal vein, okay. It is wide as compared to that of the left branch of the portal vein. It is short, wider and short, and immediately it will go into the substance of the liver, okay, that is the right lobe of the liver, okay, at the right end of the porta. With the dotted line I have drawn the porta hepatis margin, okay, and you know what is porta hepatis, from where this is the site where the structures are passing in and coming out through the liver, okay, that area is called as porta hepatis. What is going in is the portal vein, okay, and hepatic artery, and what is coming out is the bile duct, okay, lymphatics, okay. Now this is the wide and short right branch of the portal vein, okay. It enters the right lobe of the liver at the right end of the porta. This is the left end of the porta hepatis, this is the right end of the porta hepatis. The left branch is long and narrow, okay, it is long, and it enters the left lobe of the liver at the left end of the porta hepatis. So this is the termination of the portal vein at the porta hepatis, okay. So we have seen its formation, we have seen its termination, and in between the formation and termination we have seen also its course, okay. We have seen the course of this. Let us come to the parts of the vein, okay. We will see the what are the different parts of this vein and what are the relation of these parts, okay. Now, portal vein is divided into three parts. Which are those three parts? The three parts are the infraduodenal, retroduodenal, and supraduodenal, which can be seen here in this diagram. This is the infraduodenal part, which lies in the neck of the pancreas. Okay, posterior to the neck of the, it is called as the infraduodenal because it is below the first part of the duodenum. Then the part of the portal vein which lies behind the first part of the duodenum is called as retroduodenal part, and the part which lies above the duodenum, first part, it is called as the supraduodenal part of the portal vein. Okay, supraduodenal part. Let us now see the relation of the infraduodenal part, okay, which lies at the neck of the pancreas. Okay, now anterior relation of the infraduodenal part is the neck of the pancreas. Okay, it is the neck of the pancreas because it lies just behind the neck of the pancreas. Okay, in infraduodenal part. What is its posterior? What lies posterior to the this infraduodenal part? The posterior, it is inferior vena cava, and this inferior vena cava lies posterior throughout its course. Okay, throughout its course, right from formation to that of the its termination. Okay, in termination, almost up to the termination, it is the inferior vena cava which will form its posterior relation. Okay, when if you have put your finger in the foramina epiploic, okay, or additus to the lesser sac or opening into the lesser sac, then the posterior boundary of that foramina was formed by the inferior vena cava, and anterior boundary immediate was formed by the portal vein. Okay, so it lies, inferior vena cava is its posterior relation. What is lying onto the right side, okay, of the portal vein? In its infraduodenal part, it is the bile duct which is lying. Okay, this is the bile duct when it is going to open into the second part of the duodenum. Okay, this is close to it. Okay, close, and it's on to its right side. Okay, in the infraduodenal part. Okay, let us see this. Okay, see here. This is that part. So the bile duct will lie to its right side. This is the right side. This is the left side. Okay. So the bile duct will lie here, and then it will go to the middle of the second part of the duodenum here. So for some distance, it lies to the right side. So this is the bile duct. Okay, which lies to the infraduodenal part, to the infraduodenal part of it. Then let us see the relation of the retroduodenal part that lies behind the duodenum, first part of the duodenum, behind the first. Anterior relation, naturally it is the first part of the duodenum and the gastroduodenal artery which is coming from above. Gastroduodenal branch of the hepatic, common hepatic artery. Okay, that will run downwards on the posterior aspect of the first part of the duodenum. So these are the two relation of the retroduodenal part of the portal vein. Retroduodenal, when it lies posterior to the duodenum. Okay, anterior relations. Okay, these are anterior relations. So the first part of duodenum and gastroduodenal artery. Then what lies posterior? The same thing. Okay, inferior vena cava. Okay, it is inferior vena cava which was on the infraduodenal part. It will be also on to the retroduodenal part. Let us go to the third part and its relation, which is supraduodenal part, above the first part of duodenum, right up to porta hepatis, where it is forming the anterior wall of the epiploic foramina. Anterior relations are the bile duct to the right side and hepatic artery to the left side. That means these are the two structure, bile duct and hepatic artery. They lie just anterior to the portal vein. Say if I try to draw a diagram here, this is the portal vein, this is the right side, and this is the left side. This is the portal vein, supraduodenal part of the portal vein. So on to the right side, will lie the bile duct. So this is the bile duct which will be related in front of the portal vein, and on to the left side will lie the hepatic artery. So they are just lying anterior to the portal vein. So this is portal vein, this is bile duct, and this is the hepatic artery which is left to that of the bile duct. It is on to the left side of the bile duct. So these are the anterior relation of the bile duct, hepatic artery and the bile duct. So they are two anterior relation. Posterior relation, same, the inferior vena cava. Okay, it will be the same inferior vena cava, because I said that when you will put your finger in the foramina epiploic or adatus to lesser sec, you can feel the anteriorly the portal vein and posteriorly the inferior vena cava. Okay, inferior, and below the first part of the duodenum. Below you can feel the first part of the duodenum inferiorly, and you can also feel, okay, superiorly the chordate process of the liver. That means liver, which is close to porta hepatis. Right. Then we come to the tributaries of the portal vein. What are the tributaries? Many tributaries, okay, which brings the blood to the portal vein. Okay, let us see the list of the tributary first. And these two, superior mesenteric and splenic, they unite to form the portal vein. So naturally they are the biggest tributary. See this is the splenic vein coming, and this is the superior mesenteric vein. They unite to form just behind the neck of the pancreas this portal vein, and right up to its division into right and left branches. This is the portal vein, about 8 centimeter long. So these are the two important tributaries, superior mesenteric and splenic. Now that is the tributaries which have formed the portal vein, okay, which have formed the portal. Then the real tributaries which are opening in the portal, are bringing the blood to the portal vein, directly in the portal vein, are the right gastric and the left gastric. Let us see here on to the left side. This is the left gastric and this is the right gastric veins. Okay, right gastric, and which lies at the lesser curvature of the stomach. They pour their blood into the portal vein directly from the stomach. Okay, the blood comes from stomach and that is poured into the portal vein. So right gastric, and these are the left gastric. Okay. So these are the two gastric veins which opens into the portal vein. That means not only the small intestine, but the portal vein is also, I mean to say, collecting blood from the stomach and duodenum. Okay, gastroduodenal, okay, artery, and similarly the gastroduodenal vein is also there. Okay, or pancreaticoduodenal vein. Let us see the third direct tributaries is the superior pancreaticoduodenal. See here. See this superior pancreaticoduodenal branch is here, that lies in the gap between the pancreas and duodenum, second part of the duodenum. So it is called a superior pancreaticoduodenal branch, and this vein drains its blood into the this part of the portal vein, which is called as the infraduodenal part. Okay, so it is draining the blood not only from that of the pancreas but also from the duodenum. So it is called as pancreaticoduodenal branch. So this is another tributaries. Okay, then cystic artery, cystic vein. After this cystic vein, the cystic vein will bring the blood from the gallbladder. It will bring the blood from and it will run along with the cystic artery, and then it will pour its blood into the right branch of the portal vein, not directly to the portal vein, but it will pour its blood onto the right branch of the portal vein. So this is the cystic vein, right? Similarly, the left branch of the portal vein, which is long and towards the left hand of the porta hepatis, okay, which is opening into the left lobe of the liver, will have one or two branches which are bringing the blood from umbilical region, okay, and these veins are running along with the ligamentum teres in falciform ligament, okay. So this is the para-umbilical veins. These are the para-umbilical veins. So they are bringing the blood from the anti-abdominal wall around the umbilicus, and then they run along with the ligamentum teres in falciform ligament, and ultimately opens into the left branch of the portal vein near the porta hepatis, okay, near the porta hepatis. So these many are the tributaries. Thus we see that the blood comes to the portal vein from the gastrointestinal tract, right from the stomach, duodenum, jejunum, ileum, colon, okay, and all type of colon, right up to the anal canal. The blood is brought to that of the portal vein. And beside this, it brings the blood from the gallbladder, it brings the blood from the pancreas, it brings the blood from the spleen, okay. So there are so many sources of the blood which comes into the portal vein, okay, it comes into the portal vein, right. So this completes the tributaries of the portal vein. Let us go last point, and that is the applied anatomy of portal vein. Now this is the portal vein here, portal vein formed by the superior mesenteric and the splenic vein at the neck of the pancreas, and then divides into right and left branch. Now this right and left hepatic, these portal vein branches, they enter into the right lobe of liver and the left lobe of liver, where they break up into the, means they divide, redivide, okay, along with the hepatic artery, and then ultimately, and these branches of portal vein, they pour their blood into the sinusoid. And what are sinusoid? They are nothing but the dilated blood space similar to the capillaries, but they are much more larger, wider than that of the capillaries. So the blood flows through the liver sinusoid, and ultimately both from right and left lobe it goes to the hepatic vein, which opens into the inferior vena cava, okay, it opens into the inferior vena cava. Now usually the blood pressure within the portal vein is too low, because as I said, it has to drain the blood in anti-gravity direction, and it is a venous blood, and it has come after formation of one capillary plexus within the intestine wall of the intestine. There has been already one capillary plexus, and then this is the vein. So the blood pressure is hardly around 10 millimeter of mercury, okay, 10 millimeter of mercury. But then this venous pressure is sometimes raised within the portal vein, and when the venous pressure within the portal vein is raised, okay, more than I think 40 millimeter of mercury, that means right from 10 to 40, 4 times more, then that condition is called as portal hypertension. This is called as portal hypertension. So there is a lot of blood flow. Then question comes, why there is a portal hypertension? Why the blood pressure or the venous pressure within the portal vein increases and reaches to the 40 millimeter of mercury or crosses it? This may be because of the obstruction in the blood flow, obstruction in the venous blood flow through the portal vein or its tributaries. Okay, and most important cause of this is cirrhosis of liver. As I said that both right and left branches, they break up in sinusoidal spaces, and then this passes to the inferior vena cava from portal vein. Now, if there is something goes wrong into the liver itself, that means the liver become fibrotic. That means the normal parenchymatous tissue of the liver and its sinusoid in a disease called as the cirrhosis are replaced by the formation of the fibrous tissue, and this obstruct the flow of the blood. The liver become hard, fibrous, and then the blood is not passing sufficiently from through the liver to the inferior vena cava. So the blood starts collecting here into the tributaries and into the main portal vein. Okay, main portal vein. This may be one of the important cause, that is cirrhosis of liver or fibrotic disease, as it is seen into the chronic alcoholics. The alcoholics, they after chronic alcoholism for many years, if they are constantly drinking, their liver get fibrotic, so that there is a increase in the portal venous pressure, or the hypertension takes place, portal hypertension, and dilatation of the portal vein and its tributaries. And since this blood is coming from where? Ultimately, this venous blood is coming from first set of the capillary, that is the which is present in the intestine mostly, okay, or spleen. So what will happen, that if then the plasma from the blood will start coming out from the capillary spaces, okay, or here into the intestine, and then it will pass through the peritoneum serous layer and will come into the peritoneal cavity, and the lot of the fluid will start collecting into, okay. In the wards you will see many patients with the portal hypertension with a very big belly, okay, tummy, okay, which is full of the in the peritoneal cavity. There is a lot of fluid collection takes place here. Right, and this is due to the cirrhosis of liver or obstruction. Sometimes it may also be due to the thrombosis of portal vein. See, this is the portal vein, and if something blood clot takes place within the portal vein, this will also lead to the obstruction of the venous flow, and then this is called as thrombosis of the portal vein, and the same condition will result. Okay, now because of this, what will happen? Okay, because of the portal hypertension, the most important thing which will take place is ascites. Ascites is a condition where I told you that because of the portal hypertension, the exudate or this blood plasma start coming out, okay, and we start collecting inside the abdominal cavity in the peritoneum, in the greater sac of the peritoneum, in the greater sac of peritoneum. Right, and when it is full of this fluid, then this condition is called as ascites. Now then, this is because of the capillary plexus of the portal veins are present inside the intestine, large and small. But then spleen will also get enlarged, okay. There will be a large spleen called as the splenomegaly. The term used is the splenomegaly because spleen will become very large, okay, because of the same reason, and that is called as congestive splenomegaly will takes place, right? Now, because of this increase in the pressure, there are certain sites in the body where there is an anastomosis between the systemic vein. Systemic vein means veins which will drain their blood into the vena cava, either superior or inferior vena cava. They are called as systemic veins, okay. And this communication is between the tributaries of the portal vein and this tributaries of the systemic vein. That means those tributaries of inferior vena cava and superior vena cava and tributaries of the portal vein, they usually have the anastomosis, but anastomosis is not functional. Means hardly any blood is passing between the tributaries of portal and the tributaries of systemic vein. But when the pressure will increase within the portal vein, then the blood will start flowing through this systemic anastomosis, okay, towards the inferior vena cava and the superior vena cava, okay, inferior vena cava. But then this anastomosis is not that enough that it can cure your ascites or splenomegaly, okay. Yes, it will start, but it is not enough, okay. So this is called as collateral circulation through portosystemic communication. It is called as portosystemic communication. And there are various sites where significant portosystemic communication can take place. For example, we have seen the branches here, okay, that is para-umbilical vein, which were coming from the umbilicus, okay, and these veins are the will be at the umbilicus, this para-umbilical vein, which are tributaries of the portal vein. They communicate with the systemic vein, okay, and systemic vein in the umbilical region or the vein that is called as superior epigastric and inferior epigastric veins are there. They communicate, okay. As I said that usually there is no functional communication, but in pressure this communication will open up. So the blood will start going from para-umbilical vein in the reverse direction. It will go to the superior epigastric and inferior epigastric tributaries, okay, and then it will go to the inferior vena cava and that of the superior vena cava, okay, inferior vena cava. So this is the one of the side, and thus the veins at the umbilicus, they will dilate and will radiate in all the direction, and this condition is called as caput medusa. I will tell you detail in the next video, where I will teach you about this portocaval anastomosis in detail. Next video. Okay, there may be other side. For example, inferior mesenteric vein brings the blood from that of the, rectum, but the anal canal and rectum are at the same time are also drained by the middle and the inferior rectal veins, and there is a communication between superior rectal vein, which is tributary of the inferior mesenteric vein here, and that of the middle and inferior rectal veins, which opens into the inferior vena cava. So this communication will also open, and this communication, okay, will be at the lower end of the rectum and anal canal, okay. This dilatation of the veins will be called as the piles, okay. You must have heard the word piles. I think this much of the portocaval anastomosis is enough, because I am going to talk about this in the next lecture, okay. Thank you very much for watching this video.